Okay, welcome to our live stream. You can see we're performing a thoracic Deuk plasma rhizotomy on this patient who has thoracic pain and she has facet joint pain. Yep, I'm going right over the edge of that TP right there. So I feel really good about it. That's one down. She has thoracic facet pain from T6, 7, 7, 8, 8, 9, 9, 10 on both sides. So we're going to be doing a bilateral thoracic rhizotomy. We call it a Deuk plasma rhizotomy shot. It's done with a higher energy than an RFA shot. And the goal here is to deaden the nerves that innervate the facet joint. Shot. Shot. The key is you have to be careful and make sure you feel the bone. If you don't stay on the bone, it could be a problem. I feel the bone. Shot. It's literally underneath my probe. Shot. I'm going lateral 2. I'm feeling the TP. Shot. Shot. So you want to march it out from the transverse process because that's where the nerve, the pain nerve runs. I feel pretty good about that. So a 2 down.
You want to go for the same or no?
I don't know if I can. I'll try. Stay there. Do not come on yet, Jordan. Let me see if I can. Shot. It's 2 lateral. Shot. It's more medial. Shot. Shot. You can see the transverse process right there. Show them, Jordan. Shot. Shot. This patient has traveled here to Deuk Spine from Pennsylvania. And once again, she had Deuk laser disc repair for her discs. It worked great, but she also had thoracic facet pain. So we had to treat that as well. Shot. I can feel the transverse process. You can see it right there in the picture. You could feel the TP. She's asleep. Shot.
Trying to get those muscles.
No, they're perfect.
Oh, okay.
Oh yeah, we have no muscle issues. No, we don't need to go deeper.
On these cases, I'm going a little deeper.
Let's see what we got there. Shot. Just want to make sure I get everything. That's like right where the nerve comes out, right there. You guys see that? It's like perfect. I feel bone. Hopefully we got it. All right, I see the next target. Don't come on yet, because I want to make sure Shot. Need to be south. Shot. More south. Is that such a thing, more south? Shot. That's perfect. I'm on the bone. Sorry guys and gals watching, I know this goes pretty quick, but we like that. The fact that it goes pretty quick. I know. I'm just thinking it's kind of a stretch down, so I want to. All right. So far, so good. She's doing great. Shot. Watch your hands. Shot. All right, it's a little lower than I want to be. I want to move up a little bit, but I still feel the transverse process. I'm right on top of it. I went from the bottom part, a little too medial. Now nearer to the top. That's the perfect spot right there. And I feel bone. That's where the pain nerve runs. We know that. That pain nerve literally runs right where that top of the transverse process meets the superior facet. Shot. Right, shot. See where the tip of the probe is? Show them. Right where the tip, just lateral to that, is where that nerve is. One more to go. Let me see where we are. Yep. We'll do that last one and we'll be done on this side. We still have the other side to do. Shot. Perfect. Literally right on top of it right there. You see that? Huh, Jordan? Do you agree? Shot. Yeah. It's just me scraping the bones. Shot. All right, we're done with one side. She's doing fantastic, by the way. Any questions?
No current questions.
We're able to treat all those facet joints with just 2 little cuts, 3 millimeters each. Got 10 minutes max. Let's go back up to the top and shot. All right.
Oh, we just got a question.
Okay, move your hand. Yes, question, go ahead, shot.
This comes from Kelly on YouTube.
Go ahead, Luis.
And they ask, I tried to load my CDs, MRIs, and CTI discs, and it would not work. Customer service told me I had to fill out the information on the computer. Can I send my CD next day air to you? I have neck, thoracic, and lumbar for you.
Yes, so thanks for asking. For the MRI review, it is free to do your MRI review, but we do require you to fill out the form. And if you've done that, and you are wanting to send the studies to us shot by UPS, no problem. We'll accept them. That's perfect. We like CDs. CDs are easy. Shot. We can load them into our PAC system quite easily. So it would be fine. Just make sure if you send a CD that you label it properly with your name and phone number. I would put that on there as well. If you want us to send it back to you, okay, then you're going to want to send us a self-addressed envelope with stamps, postage, so that we can send it back. Otherwise, we just shred them when we're done. All right, that's one down. Shot.
We have a comment from Kelly on YouTube.
Sure.
They said, okay, Dr. Deuk, will do. Thank you. I was told I could do a thumbnail as well. I will burn the second set and send them.
Yeah, thank you. You're welcome. I don't know what a thumbnail is, but maybe that's just your name and stuff, so.
I believe that would be, thumbnail, name, and
Shot?
where they sent it from.
Yeah, I would just verify that with Sam. She's the one who does the MRI reviews. But as long as you have we have your CD with your images, we have your form filled out online, then we should be able to do it. Starting to get more responsive, huh? Shot? That looks pretty damn good right there, huh? It's like right where the TP meets the facet. Shot. Shot. I think I want to just get this one more spot right here, and we'll be good. All right. That's 2. Shot. Shot. The nice thing about the spine here is that the lamina spinous processes, all that bone will protect your delicate structures. You just have to be careful with the lungs. Shot. 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 Almost done, 5 minutes. Shot. Shot. Go ahead. Luis, great job. Thank you. Yep. As always, thanks everybody.
These next two cases, we're gonna get better turnovers than a German grade.
Better turnover than a German what? That's too funny. Shot. Shot. Any questions from the audience at this point? Shot?
No
When I-
current questions.
By the way, when I say shot, I'm asking for a fluoro picture from my technician. So I say shot, but it really means take a picture. It's just terminology I learned a long time ago in my training. We called it shot. To take a fluoro shot, it was a fluoro shot. But it's not really, I'm not drinking here. It's not a shot of tequila or anything. It's not a firing squad yet. Shot? Shot? You can see I'm on shot. I'm just on the transverse process there. And it's slipping a little bit. Shot? Yeah. I'm literally right where I want to be in there.
We have a comment from Kelly on YouTube.
Yes, Kelly, shot?
They said, good to know. I was wondering if it was an injection or a picture.
Shot? Yeah, that's a great question. Yeah, could be either, right? Yeah, so it's just like I said, it's an old phrase or old terminology for a picture shot. And honestly, I mean, right there, it's perfect. Other people say picture. My partner says picture, Dr. Patel. He's picture. But I don't know why neurosurgeons say shot. I don't know that all of us do it, but where I did my training, it was shot. Kind of a habit it never died. Shot. All these years I've been just saying the same thing, you know? Shot. Shot. Can see the last transverse process I'm working on right there.
Two of them is fine. No, 2 by 2.
Shot. Right in the crack there. Right where you want to be. Shot. Again, the key here is while you're doing this procedure, as a surgeon, you want to make sure that you're feeling the bone. You don't want to go past the bone. See, I feel like I'm just north of where I want to be. There's the bone right there. Shot. That's perfect right there. Great job, everyone. Thank you so much. Let's clean this up and then we'll show the audience what this looks like here. I got it.
You got it? I mean, it's
You guys see?
Lights on, please.
By the way, those are my initials. These are where her pain was. So what we did was we went in, we used a 3mm incision. And we just went in and targeted all the spots where the pain nerve to the facet joints are. And we did a real good burn and transection of the nerve, the pain nerve, called the medial branch of the dorsal ramus. We literally just went in and sliced through it and burned it so that the pain hopefully never comes back. Thank you, everybody. Great work. And let's just go ahead and wrap this one up, Henry.
Copy that.
We'll be back for another surgery in a little bit.